Dr. Muslim Suardi, MC, apt. Metabolism. Dr. Muslim Suardi, MC, apt. Faculty of Pharmacy. University of Andalas. 2008. Elimination. The irreversible removal of drug from the body by all routes of elimination. Metabolism. Excretion. Non-enzymatic, ester hydrolysis. Metabolism. Biotransformation. The process by which the drug is chemically converted in the body to a metabolite. Enzymatic. Non-enzymatic, ester hydrolysis. Place of metabolism mainly, liver, kidneys, lungs, small intestines, skin. GI mucosal cells. Microbiological flora in the distal portion of the ileum and large intestine. Metabolism in the liver. Clearance. The process of drug elimination from the body or from the single organ without identifying the individual processes involved. The volume of fluid cleared of drug from the body per unit of time, milliliter per minute. Biotransformation reactions. Active drug to inactive metabolite. Amphetamine phenylacetone. Active drug to active metabolite. Codeine morphine. Inactive drug to active metabolite. Heterocycline ampicillin. Active drug to reactive intermediate. PCT reactive metabolite. Reactions phase I more polar metabolites asynthetic reactions. Phase II. Conjugation. Synthetic reactions. Much more polar metabolites. Phase I. Occurs first. Introduce or expose a functional group on drug mole. Oxygen into phenyl group of phenylbutazone by aromatic hydroxylation to form oxyphene butazone. Codeine is dimethylated to form morphine. Hydrolysis of S2-aspirin to form salicylic acid. Phase I oxidation aromatic hydroxylation N-hydroxylation. Side chain hydroxylation. N-O, and S-dealkylation. Deamination. Sulfooxidation, N-oxidation. N-hydroxylation. Reduction as orduction. Nitroreduction. Alcohol dehydrogenase. Hydrolysis ester hydrolysis. Amide hydrolysis. Phase II salicylic acid with glycine to form salicylic acid. Salicylic acid with glucuronic acid to form salicylglucuronide. Conjugating reagents. Derived from biochemical compounds involved carbohydrate, fat, and protein metabolism. Phase II glucuronidation by glucuronic acid sulfation by sulfate. Amino acid conjugation by glycine. Acetylation by acetyl-CoA. Methylation by CH3. Glutathione conjugation by glutathione. The rate constant of elimination, K, equals. Hepatic elimination. K equals Km plus K. The rate constant of elimination, K, equals. First order rate constant for metabolism, Km, plus the first order rate constant for excretion, K. Clinical focus. The overall L half-life, T1/2, of a drug is 2 hours, K equals 0.3465 per hour, Km equals 0.104 per hour. If the renal excretion pathway becomes impaired as in the case of certain kidney disorders, then less or none drug will be excreted renally and hepatic metabolism may become the primary drug elimination route. Clinical focus K equals Km plus K, but K equals 0, thus K equals Km. T1/2 equals 0.693/K. Equals 6.7 hours. Variation of biotransformation enzymes in humans. Genetics factors. Environmental factors. Drug interactions. Physiologic conditions. Drug dosage regimen. Genetics factors genetic different within population. Racial differences among different populations. Environmental factors. Enzyme induction. Enzyme inhibition. Enzyme induction, enzyme inhibition. Drug interactions. Enzyme induction, enzyme inhibition. Physiologic conditions. Age. Gender. Diet/nutrition. Pathophysiology. Drug dosage regimen, route of drug administration. Dose dependence, nonlinear, pharmacokinetics. Genetic differences in drug elimination. Pharmacogenetics. Genetic differences in drug elimination. INH. N-acetylation. Rapid and slow acetylation. Slow acetylation neurotoxicity. The differences is referred to as genetic polymorphism. Genetic polymorphism procainamide acetylated hydrolase in acetylated glucose 6-phosphate dehydrogenase deficiency, approximately 10% of Black Americans. Phenytoin, efficient, and poor metabolizer. Propranolol, difference among Chinese population. DI involving drug metabolism. The enzymes involved in the metabolism of drugs may be altered by diet, co-administration of other drugs and chemicals. Enzyme induction. A drug or chemical stimulated increase in enzyme activity, usually due to an increase in the amount of enzyme present. E.g., phenobarbital, carbamazepine, rifampicin, benzopyrin, smoking, chlordane, insecticide. Enzyme inhibition may be due to substrate competition or due to direct inhibition of drug metabolizing enzyme, particularly one of several of the cytochrome P450 enzymes. E.g., fluoxetine decrease the CL of IMI due to its inhibitory effect of hydroxylation. Inhibition inhibitors example result PCT increased hepatotoxicity. Cimetidine, warfarin, prolongation of prothrombin time. Erythromycin, carbamazepine, decreased carbamazepine CL. Induction inducers of drug metabolism example result carbamazepine PCT. Increased PCT metabolism. Rifampin, methadone. Increased methadone metabolism, first-pass metabolism. First-pass effect. Routes of administration may affect the metabolic rate. A drug given parenterally, transdermally, or by inhalation may distribute within the body prior to metabolism by the liver. First-pass effect. In contrast, drugs given orally are normally absorbed in the duodenal segment of the small intestine and transported via the mesenteric vessels to the hepatic portal vein and then to the liver prior to the systemic circulation.